advanced embryology techniques and innovations, artificial intelligence and machine learning in embryo selection. Artificial intelligence, AI, and machine learning, ML, are revolutionizing the field of embryology, particularly in embryo selection during assisted reproductive technologies, ART, such as in vitro fertilization, AVF. These advanced techniques aim to enhance the accuracy and efficiency of embryo selection, providing a more objective approach to predicting embryo viability and ultimately improving pregnancy success rates. This section explores the role of AI-driven algorithms in embryo selection, discussing their implementation, benefits, challenges, and ethical considerations. 1. Overview of artificial intelligence, AI, and machine learning, ML, in embryology. A. Artificial intelligence, AI. Artificial intelligence refers to systems or algorithms that can perform tasks typically requiring human intelligence, such as recognition, decision-making, and pattern detection. In ART, AI can analyze large data sets and provide predictions based on historical outcomes, clinical data, and embryo characteristics. B. Machine learning, ML. Machine learning is a subset of AI, where algorithms learn from data and improve performance over time without being explicitly programmed. ML models can be trained on embryo images, embryo development data, and other relevant parameters to predict embryo viability and implantation potential. Second role of AI in embryo selection. A. Predicting embryo viability. Embryo viability prediction refers to the ability of an AI model to assess the quality and potential success of an embryo for implantation and subsequent pregnancy. AI-driven algorithms analyze key parameters such as morphological features, size, shape, fragmentation, etc., embryo development stage, cleavage stage, blastocyst formation. Time-lapse imaging data, growth patterns over time, genetic information, if available. B. Implementation of AI-driven algorithms. Data collection. Large data sets from embryo imaging systems, time-lapse systems, and patient records are collected to train AI models. Algorithm training. The AI system is trained on these datasets to learn the patterns that correlate with successful pregnancies. Prediction. Once trained, the AI algorithm can predict which embryos are most likely to result in a successful pregnancy, allowing for better informed decisions during embryo transfer. Third, benefits of AI in embryo selection. A. Enhanced accuracy. AI-driven algorithms can analyze vast amounts of data and recognize patterns that might be overlooked by human embryologists, increasing the accuracy of embryo selection. The use of machine learning models can help eliminate subjectivity in embryo grading, providing a more objective approach to choosing the best embryos for transfer. B. Improved pregnancy outcomes. By predicting the viability of embryos with high accuracy, AI can improve the success rates of IVF by selecting embryos with the highest implantation potential. This can lead to fewer embryo transfers, reduced multiple pregnancies, and better pregnancy outcomes. C. Reduced human error and bias. Embryologists may have limitations in their ability to evaluate embryos due to fatigue, human error, or personal biases. AI removes these limitations by providing consistent data-driven assessments. D. Personalized treatment plans. AI can integrate patient-specific data such as age, hormonal levels, and embryo quality to help tailor IVF treatments to individual needs, potentially improving the chances of success. Fourth, challenges and limitations of AI in embryo selection. A. Data quality and availability. The success of AI algorithms depends heavily on the quality and quantity of data. High-resolution embryo images, time-lapse data, and clinical records are essential for training accurate models. Inconsistent data or limited datasets can result in biased predictions or reduced effectiveness. B. Lack of standardization. Embryo selection and grading systems can vary across clinics and practitioners, leading to a lack of standardization in the data used for training AI algorithms. Standardized protocols for embryo evaluation across different ART centers are needed for AI models to be generalizable and effective in various clinical settings. C. Ethical considerations. Bias in data. If the training data used to develop AI models is biased, e.g., based on specific ethnic groups or age ranges, the predictions may not be as accurate for all patients. Transparency and accountability. There needs to be transparency in how AI-driven algorithms are trained and implemented. Patients should understand how the technology works and how their data is being used. Data privacy. The use of patient data for AI models raises concerns about data security and privacy. Robust systems must be in place to ensure that patient confidentiality is maintained. D. Integration into clinical practice. Human oversight. While AI can provide powerful insights, it is essential for embryologists and clinicians to remain involved in the decision-making process, especially since the final decision on embryo transfer often involves personal values, ethical considerations, and patient preferences. Cost and accessibility. AI-driven technologies can be expensive to implement, potentially limiting their accessibility to certain clinics or patient populations. 5. Ethical considerations in AI-based embryo selection. A. Patient consent and autonomy. Informed consent is crucial when using AI in embryo selection. Patients must be fully informed about the AI systems involved in their treatment and how their data will be used. Patient autonomy should be respected, allowing patients to make informed decisions about whether to use AI-based embryo selection or not. B. Fairness and non-discrimination. AI systems must be designed to avoid biases related to age, ethnicity, socioeconomic status, or health conditions. Ethical oversight is necessary to ensure that AI-based predictions do not result in discriminatory practices in embryo selection. C. Potential for designing embryos. The increasing accuracy of AI in predicting embryo viability could lead to concerns about the non-medical use of embryo selection, such as choosing embryos based on genetic traits unrelated to health, e.g., eye color intelligence. Ethical guidelines must ensure that AI-driven embryo selection remains focused on health outcomes and does not cross into genetic enhancement or designer babies. 6. Future of AI in embryos selection. A. Advancements in AI and ML. As AI and machine learning algorithms continue to evolve, They will become increasingly sophisticated in their ability to predict embryo viability based on a wider range of parameters, including genetic, morphological, and developmental data. Integration with genetic testing, e.g., PGTA, PGTM, will allow for even more precise embryo selection, further improving IVF success rates. B. Personalization of ART. The future of ART may see personalized treatment plans driven by AI algorithms that consider not only embryo viability but also patient health, genetic predispositions, and past treatment outcomes. C. AI-assisted counseling. AI systems could also assist in providing personalized counseling to patients by offering data-driven insights into embryo viability and ART success rates, helping patients make more informed decisions during their fertility journey. 7. Conclusion. The integration of AI and machine learning into embryo selection holds significant promise for improving the accuracy and efficiency of ART treatments. By enhancing prediction models for embryo viability, AI has the potential to improve pregnancy outcomes and personalized care in fertility treatments. However, ethical, legal, and practical considerations such as data quality, patient consent, and bias in algorithms must be carefully addressed to ensure that AI-driven embryo selection remains an ethical and effective tool in ART.